my first check. Doctor's order, yeah? Okay.
I got a million at home.
Check number 1, medication, doctor's order. Watch me closely how many times I'm checking it. I got it from the cabinet. Codeine, 30 milligrams per tablet. Doctor's order says what? 90. How many tablets would I give?
3.
3. First thing, when you open the medication bottle, make sure that you don't contaminate what's inside. Don't touch the inner part of the bottle. Lay the cap inside what? Up. When you need to transfer the medication from the bottle to the pill cup. Nobody's watching.
30-second rule.
Sorry. Nobody sees that.
Those are really expensive.
A pill of this is really $5,000.
That happened in real life.
Maybe one for me.
Take 2. You'll feel better.
Yeah, take 2.
So, the way to do it is obviously you're not touching the medication, and if you drop, obviously what do?
Discard.
Now, there's some medications that are inventoried, and watch closely how many pills are on the bottle. So what if you drop a pill on the floor? What do?
You have to log it in as.
Very good, thank you. You have to log in, and you have to have somebody witness that you did in fact dropped it. Either your supervisor or your co-MA, whoever your senior, they, hey, you know what? I dropped it on the floor. It's contaminated. Obviously, we're not giving it to the patient, and it's monitored on how many more pills left in the bottle. Then you sign it, and you have the other witness sign it as well. Are you guys with me? So if you drop it on the floor because it's expensive, try not to what?
Put it back.
Okay.
Pick it up.
So how do you do it? 3 bottles or 3 pills? 2, 3. Without touching the pills. Are you guys with me? You replace the lid with the cap before you.
If you accidentally pour more in the cup, is it okay to put it back in?
You can put it back in without touching it. But once you touch it, it's contaminated. You contaminate the whole bottle.
And you can't wear sterile gloves and
You're not required to wear sterile gloves. Because
gloves,
even
though, but
sorry?
I'm sorry. Yeah, you can wear gloves.
Yeah,
but,
you can.
But you don't have to.
Exactly. It's not required.
No.
So now we have the bottle, the 3 pills. That's my first check, the order, second check, and I will bring the bottle with me. Put it on the tray. Are you guys with me? I knock at the door. Knock, knock.
Who's there? I mean, come in.
Hi, Mr. Anderson.
Yes.
Can you please state your first and last name and your birthday, please?
Eric Anderson, July 12, 1980.
75. Okay.
75.
All right.
I'm old.
Dr. Bernard, my name is Leonard Delphin. I'm your medical assistant today. Dr. Bernard asked me to give you some codeine medication. Did he discuss this with you already? Okay.
I'm hurting.
You're hurt. Okay. Have you taken this medication before?
No.
It's the first time? Do you think you're allergic to any medication with codeine? Are you aware of any? Okay.
None that I know of.
All right, so Dr. Bernard explained to you the benefits and the risk of the possible side effects, right?
Yes.
Do you have any questions?
Oh, actually, yeah, you can.
No, very good.
Use your.
So, Mr. Anderson, I'm going to put this 3 medication. The doctor said 90 milligrams, so I'll give you 3 tablets. Okay.
I guess so.
And you can take it at the same time or one at a time.
Yeah, 1 per pair.
Some patients are really, especially other patients are sneaky. They hate taking pills. So you really have to watch them closely. They swallowed it. Because some they will hide it behind their what? Their cheek, under their tongue. Oh yeah, I took it. But they actually didn't take it. So I'm going to have you can either give the whole cup to him or just put it to his hand. And there's a cup of water to push it down for you.
Chaser?
Chaser. Okay, very good.
You have to do that, like, open it up, like around?
It all depends on the patient. If the patient has a history of not taking it, you might want to ask him, hey, sir, I'm going to have you show me if you take it. Because I understand you don't like medication, the pill, taking pills. So Dr. Burnell wants to make sure that you're taking it all the way, all right?
Okay.
So, can you confirm? Good. Awesome. Thank you, sir. Also, I'm going to have you wait here in the exam room. Depending on the clinic, you have them wait in the exam room or in the waiting room for 10 to 15 minutes.
But I have to go now.
I understand, but I just want to make sure because it's the first time you're taking this medication, I want to make sure, Dr. Burnell wants to make sure that you don't have any adverse reactions, because if you go right away and if you will have that adverse reaction, allergic reaction, then, you know, it may be more difficult for you, okay? So I'll check back with you in about 10 minutes. And if you're okay, then you can leave, all right? Do you have any questions? Sometimes the doctor would send the patient the rest of this medication home with the patient. So make sure that you give the patient a proper instruction based on the doctor's order. Mr. Anderson, Dr. Burnett said he wants to take the rest of his pills. There's about 10 pills left here, and he wants you to finish it. You have to take it 1 tablet 3 times a day with meals. Okay, or with food. All right, do you understand the instruction?
So I gotta take one at breakfast time, and I gotta take one at lunchtime, and I gotta take one at dinner time.
You got it. Perfect. Okay. So, do you have any other questions? If you experience any adverse reactions, because you don't have anything today, so I'm not quite sure if maybe some patients, they have the delayed reaction, just feel free to contact us. And the number is 1-800-888. Okay. Okay, any questions? You guys. Now, that's your second check, right? Now,
What circumstances do you do that, like, just for somebody who goes to the clinic?
depending on the patient's, yeah. If the doctor said, you know what, this patient has been complaining of pain, or maybe some acute pain that they experienced, or maybe they had a fall and they're in severe pain, they haven't taken anything, and now they're seeing you, the doctor will say, you know what, give them some pills right now. Extra strength Tylenol, ibuprofen, whatever it is. Or sometimes insulin. Or sometimes like any pills that could help the patient alleviate the pain. Or sometimes the patient antibiotic.
I had that Thursday. A doctor, it's not my doctor that I work for, the provider said, okay, this person is needs some Benadryl or whatever, so go ahead and give it in room 5. But I didn't have this here. Okay, did you put the order in? He's like, no, it's just over the counter, OTC. And I said, no. I go, but I'm not gonna give something. Okay, so he goes in there and through the electronic medical record, he was able to do it online. And that's other point I was gonna make out is that depending on the clinic, you can actually you can prescribe and do anything for a patient as long as it's pended. It's when the doctor finally signs it that it will actually be administered. But as an MA, you are actually can be or might be responsible for doing a pending of medication, which I do it all the time now. Now that
You write the prescription.
Yeah, you write it out.
But it's not approved to be dispensed or given without the doctor's approval.
Right. So we
Some
decide-
doctors will have you write the prescription because you're his MA. Just write the prescription because he knows exactly what the patient's coming in for. And
We
that's
don't
it.
use this. This is like the old school way. But if the computers are down, then we would go back to this, and then these hard copies are invaluable at that point. And then that's when you would actually have to find your doctor and actually have them physically sign the paper.
Did you get that, guys?
Like in the
Good one, isn't it?
1800s, yeah.
All right. Also, how many checks did you notice I was doing? So my first check is to compare with the order and the medication. I put the pills in the cup. Did I do the check? I brought it to the patient and had the patient take it. Did I check? I checked the what? The patient information and the birth date. Now, my third check would be when I put it away. That's your third check. And this is what sometimes happens. Even if you do after the 2 checks, you realize it was the wrong patient. And in the event you gave the patient the wrong medication, or even it's the right patient but you gave the wrong medication because you reread it, you were just busy, for some reason you have some brain fart, like what Philomena was saying earlier. So what happens if you accidentally, erroneously, unintentionally gave the patient the wrong medication? What would you do?
Hopefully nobody finds out.
You document and you report it immediately. Dr. Bernard, I don't know what to do. I just gave Mr. Anderson the wrong dosage or the wrong medication. And the patient has what? It has to be, you have to. Any errors that you make, you have to report and document. You just pray to God that the patient will not have the what?
Will not
Massive
sue.
reaction, including death, yeah. So now how many checks?
Four.
So, order, put in the medication cup, I went to the patient, and then when I put it away.
Four.
Did I check before I give it to the patient? I already checked here. Just watch me closely. This is the order. I checked. I put in the pill. Second check. I went up to the patient. The third check is what? Information. And this is, that's why you have to say it out loud. This is codeine, 3 tablets of codeine for doctor's order. So I'm not checking anymore because I'm already saying it, right? But the most important check is when you what? Walk away and put the cup or the bottle back into the cabinet. That's your last check. That's when you confirm that you did in fact give the right medication to the right patient. And then you're charting, obviously, documentation. Any questions? Okay, so the second demonstration will be for liquid form.
We just got our new shipment in of this.
Okay, what's this?
This is the doctor's order.
Promethazine,
He's coughing.
hydrochloride, codeine, phosphate. Okay, now you have now in. Okay. Yeah, Dr. Bernard, you're just gonna get some cocktail here. So how much is Dr. Bernard's order?
Oh, well, it's not signed yet. I just penned it for you. I wrote it
What's
down
the
real
doctor's
fast,
order?
sorry.
Oh, no, I didn't make eyeballs. Who's got the eyeballs?
Right here.
Okay.
5 milliliters.
5 ml? Okay.
Yo, now.
5 ml, a cough syrup. The difference between the cough syrup and the pill is that you don't give them a cup of water, right, to wash it down. Because you cannot, what, mix it with water, otherwise if you give them a cup of water, it's basically what? Diluted in water, so the efficiency is not as strong. So here we go. Order again, Dr. Bernard's order, 5 milliliters of hydrochloride with codeine phosphate syrup. This is what is going to happen. First check doctor's order versus what I have. Always make sure I forgot to mention, check for what? Expiration date. You have to document the expiration date. Now in some clinic, they also want you to even capture the lot number. Why?
There's recalls all the time.
Yeah, there you go. If there's a recall, whoever took that medication with this lot number will be recalled as well. They'll be informed that you were provided this medication that's been recalled. And this is what our plan is. We will pay you $1 million per whatever. Okay, so. This medication comes in here. You guys look at this. This medication is 6.25 milligrams per 10 milligram per 5 ml.
Holy.
So what does it mean? 6.25 milligram of what?
Promethazine.
Promethazine per 10 mg. For that, for what?
Well, I can't see from here.
Oh,
I can see
here.
what strength you got. Still can't see.
What did you put in there?
Vodka
Vodka,
Vodka.
of course.
with codeine.
Don't drink.
Oh, look, it's floating stuff.
That's expired,
Yeah.
isn't it?
Each contains promethazine 6.25 milligrams of codeine. And alcohol.
Well, it's brand new. They swear.
Oh,
For 5 ml.
let me get one.
So 62.
Is it 2 per
promethazine,
person?
10 of codeine,
Oh,
and
no.
7 mLs of alcohol.
Some alcohol in it.
7%. Oh,
Okay.
7%
That's stronger than I thought it was.
So in measuring, you have to look at, this is a what? This calibrated cup, there is a number here, 1.5 or 5 ml. Can you see? I don't have my glasses.
Yeah.
Can you look at me? So the steps, you ordered it. Now, what you need to do is palm the label. Look at the label, then you palm it. Right? Are you guys with me? Obviously. Remove the cap, inside up, and this is the medication. That's my second order, yeah? So where is it? I didn't see it. I think I could see it. So want to make sure that the bottle doesn't touch the
Cup.
Ew, too much. That's gross.
What color is it?
What did you put in there?
Sewage.
Oh, this is from
Raw sewage.
this is from the Learning Oasis pharmacy downstairs.
Okay.
Ew.
So how much is that?
The one with the
There
med
we
sign on
got
it.
the
Don't put the meds.
It's supposed to be one each?
Oh, 2 each. Sorry.
Wait.
So the doctor's order is 12 cc. So we changed to 12 cc. Now I want to make sure that it is leveled at a 12 cc, yeah? Without touching the inner part of the lid of the cap, replace the cap. Bring this along with you.
To each group.
Approach the patient.
Each group, huh?
Same thing.
Is it each group of each?
Come in. Hi, Mr. Anderson. My name is Leonard Delphin, your medical assistant today. Dr. Bernard would like to give you some cup syrup for like 12 milliliters.
¿Cómo se fue
All
esto?
right. Have you taken this medication before?
Yes. I get
Okay.
this cough all the time.
All right. So I am assuming you're not allergic to this medication, or you're allergic. Okay. All righty. Thank you very much. Here's some drugs for you. Take it all the way down. Okay, good. Mr. Anderson, I'm going to have you wait here in the exam room for about 5 to 10 minutes. And if you don't have any reactions, you don't feel anything unusual, we'll let you go. All right? Do you have any questions? Dr. Dr. Bernard would like to take the rest of this bottle, and instruction is 12 milliliters, or half of this cup, you can see it here, every 12 hours. Okay? So since you took one already today, maybe before you go to bed tonight, you take another one before you go to bed. All right? Any other questions? No? All right. Thank you very much. Then I'm sending this out back to the exam room or to the nurse station. And before I put this away, I'll do my what? My last check. This is the cough syrup that Dr. Bernard ordered, the amount of medication I gave. I'll document on the chart. Given patient cough syrup, the name is codeine phosphate, 12 milliliters per doctor's order. Patient took it with no adverse reaction notice. All questions asked, and the rest of the bottle was sent to the patient home, or you can, depending on the situation. Any questions?